score's a 15 out of 15. The worst score you could get is a 3 out of 15. You get that for just showing up with a pulse. Alright, other things we check are labs. We can do a basic head x-ray. What's a cerebral angiogram? Angiogram. What do you think I'm checking out? The blood flow. The blood flow through your cerebellum. And then we can do a CT, which we're going to talk about in depth, an MRI or an MRA. An MRA is an angiogram done in an MRI. Does that make sense? An MRA is an angiogram done in an MRI. You're welcome. An EMG is checking out the electrical pathway from the spine down along your extremities. It's a painful little test. It's very accurate. What they do is they take a needle and they'll put it, like if I got in a motor vehicle accident and they crushed my left arm, and they wanted to know if I had nerve damage down my arm, they put a metal implant here with a wire coming off of it, another metal implant here off my neck, and then they shoot electricity and they time it. How fast does it go from here to here? And that's how they find out if there's been nerve damage, if that pathway's been disturbed. All right? It's painful. It's not nice. What's it? It's an EEG. What's that for? EEG.
Oh, it's for brain activity.
Oh, the brain.
Yeah, they take you, they wire you up like a freaking carburetor and watch the alpha, beta, delta waves in your brain.
That glue sticks.
Huh?
The glue that they use.
Yeah, I
It's
hate
now
that
right for
glue.
the whole hospital.
Yep. What's a lumbar puncture?
They take fluid out of your lumbar.
They take cerebral spinal fluid. It takes a big old 18-gauge spinal needle, it's about this long. You think I need a consent for this?
Yes.
You think this is a sterile procedure?
Yes.
Yeah, it better be. All right? They bend the patient over to open up the space in between the vertebrae. A little bit of lidocaine, and then they thread this needle with a catheter over it, just like you're starting an IV. Remember how we had the steel needle over the catheter? They thread that in there, pull the needle out. Now we've got a catheter in there and we can pull fluid out. And we send that fluid off to the pathologist to make sure there's no bacteria or viruses in it. All right? Now I got a question for you. You got a 16-year-old boy who just showed up in your ER. He got bashed in the head with a baseball during a baseball game. He's got a decreased LOC. He's got a GCS of about 6. And you notice that there's a clear fluid leaking out of his ears. What's happened?
Bad.
Huh?
Bad.
Bad? No, sweetie, this is ugly. We've gone from good, bad, straight to ugly.
Kind of fluid.
What kind of trauma? He's got a fractured skull. That fluid coming out of his ears is cerebral spinal fluid. That's why I say bam, straight down to ugly. Okay? The one easiest way, I'm going to teach you my bad habits to make you dynamite nurses, okay? The easiest way to confirm that that is indeed cerebral spinal fluid is you go boogieing over to your bedroom. You get that little container of those dipsticks. Have you guys seen those? Where you can dip them in urine and you can check for different things, right? You can check for red blood cells. You can check for ketones. You can also check for glucose. You take one of those dipsticks and you rub it in that fluid. Because if it pops positive for glucose, that is indeed cerebral spinal fluid. Okay?
You said rubbing.
Have you seen a dipstick? You know what I'm talking about, the little paper sticks with the 15 little colors on it,
Oh, yeah.
right? And then you put it in the liquid to figure out what it's got in the liquid.
For the pH.
Yeah, like a pH paper, but this one's got like 9 or 10 little
It's
slots.
like urine analysis.
Yeah, urine analysis lipstick, you can cheat, because it's got glucose test on it too. Put it in the liquid and it'll pop positive for glucose, if it's cerebral spinal fluid. A carotid Doppler. Where are my carotids? Right here, you got two of them. You got an external and an internal, right? Carotid. When we Doppler it, what am I using? An ultrasound machine.
Okay.
Alright? We go like this and we check the blood flow through it. If I've been eating too many 99-cent hardtacks in a bag, and my cholesterol levels through the roof, you can end up with horrible cholesterol hanging out in these guys. Is that going to slow down my blood flow to my head? Absolutely. Is it going to make it, instead of a smooth pathway, kind of like a lumpy, bumpy pathway? Great, that's where clots like to form. Okay? If you ever see a patient who looks like they've got a scar that goes from the back of their ear down their neck, it's just a straight line, it goes whoop, that patient has had what's called a carotid endarterectomy. That's a 10-cent word for the slice them from here to here. Get to that blood vessel, clamp it off, drain it, and they literally scoop out the cap from the carotids. I used to call it roto-rooter carotids. They're really tough, they're good. Seizures. A generalized seizure affects the entire brain. You guys ever seen a lightning storm where the lightning just goes cloud to cloud? That's what I want you to think about. It affects the entire brain. The wiring gets mismatched with either the electricity or the chemical transmitters. The entire brain gets affected. A partial seizure only affects a part of the brain. There are other things that can cause seizures than epilepsy. High fever, diabetes, right? Severe hypoglycemia can cause it. Alcohol withdrawal, very good. What about mom? What about a pregnant mom? Did she have a seizure? Preeclampsia, very good. An absent seizure, the best story I've got of an absent seizure. One of my last dogs I had was a little gold Shiba Inu. And she'd be walking through the living room, she's about 16, 17 years old. She'd be walking through the living room. She'd just check out. They just, and hold her breath. Okay? An absent seizure, it just looks like they just checked out. It can be for a couple of seconds, it can be up to like 6-7 minutes. It's really freaky.
I've seen them before.
Have you?
When the kids have fevers, they're called
Petit
mild
malls?
seizures, and they just stop. When you're taking your kids' vitals and one of the kids just stopped and I was like, what is happening? But when their fevers get pretty high, they can have those absent seizures.
A petite mal is a little bit of a tremor, as
So they
opposed
just
to a
like
grand mal, which is the fish out of water happy dance.
Mm-hmm.
An absent seizure, there's like very, very, very little movement. All right? And when you look at their eyes, it's like somebody just flipped a channel. They just check out. Chronic seizures, we usually call it epilepsy. Okay? Epilepsy. What kind of drugs do epileptics need to take? Anticonvulsants was my favorite one. Come on, guys, let's do some anticonvulsants.
Phenytoin?
Huh?
Phenytoin?
Phenytoin, what's his other name? Dilantin. You guys remember what this means? What does it mean? Narrow therapeutic index. That's why they have to have frequent labs. Okay? My best friend when I was in high school, his name was Wally. Big, tall, skinny, redheaded kid. Wally had severe epilepsy and refused to take his meds because he felt like it kept him underwater and slowed him down. The good news is, Wally also had what's called an aura, A-U-R-A. He knew when a seizure was coming on. He just felt this weird buzzing sensation. Sometimes he had enough warning where his catchphrase was, "Oh shit, seizure." Sometimes he'd only get to say, "Oh shit." Sometimes he only got to say, "Oh." And he would drop like a rock if we were walking somewhere and have a grand mal seizure. But he never would lose consciousness. He knew he was having it. We were walking home from school one time. What kind of lawns do they have, do you think, in Phoenix?
None. Narrowscape.
Cactus. We were walking down the street, Wally yelled, "Oh," and dropped like a rock, and his face went right into some cactus.
Oh, shit.
He started having a grand mal. You want to talk about severe, serious love between two adopted brothers? Felix, our other buddy who was walking with us, saw Wally drop and immediately stuck his hand between Wally's face and the cactus. That afternoon is how I got my nickname Doc. Because I spent the rest of the afternoon pulling cactus out of Wally's face and out of the back of Felix's hands.
Had a lot of experience throughout your life with
And
medical
way too
patients.
many, man. Way too many. That's how I got my good stories.
I have a question.
Yes.
So there's a kid on my
What kind was it? And what's our number one concern when a patient has a seizure?
Make sure there's no objects in their mouth.
Safety. Airway, airway, airway.
So you have the suction, you always set up suction in your room.
That's right. When a patient is on seizure precautions, we pad the beds,
Panties and blankets.
huh?
Panties and blankets.
Panties and blankets or towels and tape. I don't care how you do it. All right? You make sure the suction in the room works. You make sure there's supplemental oxygen in the room. Do I ever hold a patient down when they're having a seizure? No, because you're going to break a bone or dislocate a joint. Do I ever stick anything in somebody's mouth when they're having a seizure?
You're gonna lose a finger.
You will lose a finger. I remember they used to teach us to make bite blocks.
Yeah, why?
Because there was an old wives' tale, my love,
That they would swallow their tongue.
that they would bite
Or
off their
bite their
tongue.
tongue. Just
Oh. I
You
always
stick
wondered why.
you stick a finger in somebody's mouth who's having a seizure, you're gonna lose the tip of your finger. No, they don't. I have never seen it happen, and I've been around probably a couple of hundred people having seizures. They may bite the side of their cheek, they may bite the side of their tongue, but you're not gonna bite off your tongue. They will clench.
to break their teeth.
Yeah, they can break a tooth, but you know what? That's okay. I seen one fool nurse, old lady, had a patient that was a seizure patient. None of us knew she'd done it. She took an old tongue depressor, you know that wooden thing we all stick in somebody's mouth to go, ah, right? She wrapped it with some 4x4s and some tape. When her patient had a seizure, she put her bite block in. Put it in the guy's mouth, it snapped and embedded in the roof of his
Oh,
mouth.
wow.
Don't stick things in patients' mouths who are seizing. I wish I could show you the memory of seeing that in that guy's mouth. What else do we do when they're having a seizure? Can I put a pillow under their head? Yes. Do I get everything out of the way so they can't hurt themselves? Yes. When they're done having the seizure, what position do I put them in?
Side. Recovery.
left side line. It's called the recovery position for a reason. All right? Safety, safety, safety. Airway, airway, airway. Okay? Do I loosen up tight clothing? Yes. Ties, belts. Another thing we need to do is provide privacy. Lots of folks, if they're having a grand mal, will have a post-ictal phase, I-C-T-A-L, where they're exhausted. All right? Imagine doing 200 jumping jacks in 2 minutes. That's basically what their body's doing.
And you gotta give them dignity too, because a lot of them are young and they go to
And
the
they
bathroom all
will
the
be incontinent. That's where I was getting. When they're post-ictal and they're exhausted, they will lose sometimes control of their bowels and their bladder. So cover them up. Provide for privacy. And when they start waking back up, reorient them, because sometimes they forget what the fuck just happened.
Did they get super diaphoretic? That kid did. He
So
was
does.
like drenched and drenched and drenched. We kept getting ice packs to put on him because that's how bad he was
Yeah,
sweating.
I've seen that recently.
It felt bad. I felt bad for
50%
him.
of the time. I had to get checked for long QT center too. Young
He-
athletes like to drop, you know. All right, have you guys ever, yes,
So, scenario.
raised status in front of a medical condition before?
Yes,
For what?
for that, because I used to be on the seizure monitoring committee.
I said before,
Oh.
besides
Oh,
epilepticus.
sorry.
Asthma, good job. You guys ever hear the phrase status asthmaticus or status epilepticus? Status, put it in your brain, status means medical emergency. Status asthmaticus is asthma that's not responding to the normal sets of drugs we use to treat it. Status epilepticus is a seizure that's not stopping. It's season, 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 season. What do you think that's doing to your heart? It's overworking it, it's exhausting it. And all the other muscles in your body. Remember, I said a seizure is like doing 200 jumping jacks in 2 minutes. This is 600 jumping jacks in 15 minutes. It's continuous.
People were like, they have to have like, they have like a certain time frame before you can call 911. So like some people it's normal for them to have like,
You have to know what time the seizure started and how long it lasted. All right? If Wally had a seizure, it was usually a minute, 2 minutes, and then he'd go post-ictal on me. Okay? This is something that's going on for 20, 30 minutes at a time. This is scary stuff. This is the reason why when patients come into the facility and we know they're actively having seizures in their history, their recent history, we have to give them IV access. Immediately, as soon as they come in, bam, bam. I want 2 IVs, because if one of them failed, I want to know I got another 4 days. Miss Howard's favorite drug to break a seizure. All right, they're doing this shit, and I'm like, oh no, we're done. You've had your 2 minutes, we're done, we're stopping the seizure right now. Ativan IV. Ativan IV. You got a patient coming in, you know they're on seizure precautions. You look at the med list, the doctor has not given you an order for Ativan yet, you pick up the phone and you give him the WTF speech. I need these drugs. All right? Because this is a medical emergency.
there's Ativan not like depressed them like too much. Like, how
No,
is it
Ativan has a half-life almost as short as heparin.
really? Okay.
And besides, I can always find my Rumazepam.
I have a question.
Yes.
How long does it take to come back to like health after, like what you said, your friend would go and,
He'd be post-ictal for
Yeah.
about 5 to 10 minutes, and then he'd snap right out of it.
okay, so not very long. Thank you.
God bless you, Wally. I don't know where you're at, but I keep telling you stories. All right, assessment-wise, you need to know Do they have a pre-ictal phase? Do they have an aura? Okay? You need to know if they've had any history of hypertension or stroke in the past, especially on our seniors. EEGs. Have you guys seen the seizure wards that they've got in some hospitals? They'll wire the patient up with like a carburetor, okay, to a full 24-hour monitoring system on an EEG, and they will try to elicit, to create a seizure. They'll keep that patient up for 2 days.
Strobe light.
They'll have strobe lights, they'll have loud noises, trying to create a seizure so they can record it on the EEG. When I was in school, a billion years ago, one of my peds patients was on a seizure board, okay? His little all wired up because they had to keep her sedated with ativanilibran because she was having status epilepticus. They finally got it on the EEG and found out how bad it was. Hold on to your tables. They did a hemispherectomy.
They removed her skull.
And see, and I've
They
heard lots
took,
of,
they
Brain.
took, instead of just doing the split, because they tried doing the split, so it couldn't cross over and cause a seizure, it didn't work. And so they literally took out the entire right hemisphere of her brain.
I've heard lots of
How does she
cases where
function?
cannabis and
You
CBD
function
help
off
kids
the-
that have seizures and stop it.
Sweetie, this
But
was almost
they
30
probably
years
tried to
ago.
Oh,
put it-
okay, well, thank goodness for,
Thank God people are waking up and
Evolving.
realizing that plants can do something.
amen.
During break, let me tell you, be done in a PET scan can be done. What are our interventions? Number one, anti-epileptic drugs. Number two, make sure they're staying in the therapeutic range. Well, he made me crazy. He'd have 3 or 4 seizures a week. We have to worry about interactions between anti-epileptic drugs and other medications because they don't like to play well with others. So you better know the patient med history. Seizure precautions, and please remember status epilepticus is a medical emergency. If you see the word status in front of any condition, that's a jump on it now. Okay?
Is Keppra just a prevention of seizures?
Heparin?
Keppra.
Heparin? Yeah, it's the long term. All right. We do this real quick and then we're gonna take a break. Meningitis. Where are my meninges? Huh? It's in my brain stem, right here. So if I get meningitis, what's happening?
Inflammation.
Yes! It's inflamed. God only put so much room in your cranium. Okay, or whatever you're calling safely this week. There's only so much room. There is bone, there is white and gray matter, there is blood vessels and blood volume, and there is cerebral spinal fluid in this whole package, okay, going down my spine. If my meninges swell up because of an infection, is that going to increase my ICP? Yeah. Bad. Going to ugly, depending on what's causing the infection. All right? Viral meningitis is the most common.
So that's the one that they can't find with this.
It is. I'm afraid of the bright lights. Phobia, fear, photophobia, I'm afraid of bright lights. So a patient who has viral meningitis, what kind of rooms do we need to keep them in?
Dark.
Calm, low light. They're gonna have headaches, fever, that's what HA stands for. Nausea, malaise. Fungal meningitis is most common with AIDS patients. Why? Bingo, son. Absolutely correct. Because they are autoimmune suppressed. makes them highly susceptible. Again, you're gonna see headaches, nausea, vomiting, mental status changes. Bacterial is a medical emergency. That's the one that's gonna kill people. And 99% or 95% of the time, they have some predisposing condition. Something happened in their medical history that let that bacteria get into my cerebrospinal fluid. All right? This is diagnosed with what?
Spinal tap.
Spinal
Well, heart puncture, spinal tap. And I'll tell you what, I got PTSD from the 2 times I've had one. Because the first one I had, I was this big.
Yeah, my daughter was just 5, and then her is 5, and she
It
just had.
took 6 people to hold me down. I was hysterical. I woke up 2 days after Christmas at home. I was about 6 or 7 years old. My left eye was swollen. I looked like I'd gone 3 rounds with Mike Tyson. My ear was burning like hell, and my face was so swollen. My nose was over here. I had some kind of an infection in here. My mom picked me up, took me to a children's hospital. The pediatrician said, "Oh, we need to do a spinal tap." Didn't bother to tell me what was going on. Just had 6 people come down and hold me down. My dad met us at the hospital. His thing was, are you ready for this? Be a good girl. You can do this. Be strong. You know what my answer was? The first time I ever swore at him. They stuffed that needle in and drew out the fluid, and then I had a spinal fluid leak. Anybody ever hear that?
Yep.
Gives you the worst migraine of your life and the worst vertigo of your life. The best description of the vertigo is you feel like a tick on a disco ball. Any movement from being supine, you start to go like this, you projectile vomit.
Is that the same kind that pregnant women get if they have the epidural?
No, because this is caused by a spinal fluid leak.
And how do they fix that spinal fluid?
The way, I'm so glad you asked that. The way they fix the spinal fluid leak is doing something called a blood patch. You want to talk about how magical your body is, how amazing it is? Anesthesiologist comes in, takes blood from your arm, right? Just holds about 15 cc's, about 1 bottle. And then he takes it and he injects it right into your spinal fluid. Are you ready for this? Those platelets go, "Oh dude, the party's over here." Whoop! And they go straight to it and patch it. It's the coolest thing.
Oh, that is.
The weirdest thing is that they really want to make it work faster, they give you IV caffeine. I was a little kid bouncing off the freaking walls.
Better than having a migraine.
Blood patches work. They're old medicine, but they work. Okay? Alright, meningitis, what are you gonna see? Photophobia, headache, and this thing called nuchal rigidity. Your neck gets locked in a position. You can't move it forward or way back. It gets locked. Nuchal rigidity. Complications, increased ICP, seizures, you think you've got increased ICP. And then this really god-awful thing called DIC. And I know I didn't touch on this when we were talking about blood problems. DIC, disseminating intercoagulopathy. It's really messed up. DIC is when your body is clotting and bleeding at the same time. You're throwing clots and you can bleed to death at the same time. And here's the cool way we fix it. You ready? We treat it with heparin. Now let me tell you why. What's going to kill me faster? The clots. So we stop the clotting. We shut down that pathway with the heparin. Once we know by the lab values that those clottings have stopped, we turn off the heparin. We just turn off the heparin. Heparin's only got a half-life of about 30 minutes. Disseminating intercoagulopathy. You can Google it, I promise. Just type in DIC, it'll tell you. It is a really dangerous situation.
Disseminate.
Labs, we do the cerebral spinal fluid by doing an LP, and we check the CBC. What am I looking for on a CBC? White blood count. Good. Interventions, we do frequent neurovascular assessments. This patient has to be on droplet precautions. I don't care what kind of meningitis they're on. I want them on droplet precautions. Does that mean semi-private room? No, it means a private room. What are droplet precautions? Mask,
6 feet away.
gloves,
Eyelid.
eyewear, gown. Very good. And unless you really gotta get up close and personal with them, stay a good distance. No, I would let visitors come in as long as you strongly educate them that if they don't follow droplet precautions, they're banished. When it comes to a patient on precautions, I will give you one shot. I don't do 3 strikes, you're out. I give you one chance. If you're gonna follow my rules, terrific. If you don't, no more visitation. And then they get big antibiotics and anti-epileptics. How many of you guys remember your cranial nerves? On old Olympus, towering tops of Finland, German, and House. That's the clean version. As opposed to, to touch and feel, and I'm not gonna say any more of it. And then, of course, we put this patient on seizure precautions.
So for meningitis B, they changed the age, and now if you're 16 and older, you have to get it, and some colleges outside of the state require